This is a short video on resources on virtually unstoppable aerosol transmission of the coronavirus. The best thing to do is simply to read the article that I'm referring to, and I'll include a link to it in the show notes. So you can just go and quickly read the article, but here, if you want to listen, I'll give you a little bit of an overview of the article, which is mostly just a collection of links to some review articles and other information on aerosol transmission. So a key issue in the current COVID-19 coronavirus pandemic is the role of aerosol transmission, which is virtually unstoppable in the spread of the virus. So aerosol transmission is transmission by tiny particles only a few microns in size that float indefinitely or nearly indefinitely in the air. So they're so small that they don't fall in gravity to the ground. This is very, very small. The finest human hair is about 20 microns in diameter. Asymptomatic carriers, people who maybe have an infection or some kind of benign parasitic relationship with the virus or even some kind of symbiosis, which we don't understand, may comprise about 80-86% of the cases. People in this situation mostly don't cough or sneeze. They probably don't produce large particles that fall to the ground very often. They probably spread the virus through these aerosol particles that float in the air and can persist in the air for hours, days, travel quite far, much further than, say, 6 feet or 2 meters, for example. It can also be spreading through touching objects and physical contact. It seems very likely from basic physics that at least some transmission is by aerosol transmission, but this is very little talked about so far. And aerosol transmission is virtually impossible to stop short of wearing a spacesuit or something similar to a spacesuit. Um, Most of the masks that people are wearing, the particles are so small they'll just go right through the mask. Um, Physical distancing or may not, generally won't help that much either because they're floating in the air. If it's a substantial mode of transmission, all of the lockdown, social distancing, sheltering in place, masks, is probably largely not effective and can't explain low death numbers in regions like Santa Clara County, California, where I live. So Santa Clara County is practicing, in theory, social distancing, although there are lots of exceptions, including luxury apartment building projects, including huge numbers of people going to large stores like Walmart and Safeway, various other activities that for some reason are deemed essential. And on the other hand, people, as I'll discuss, are crammed in large apartment buildings and complexes. There have only been 128 reported COVID-19 deaths as of today, May 10th, 2020. It's a county of 2 million, almost 2 million residents, has very close ties to China. Many of the people that live here are immigrants or guest workers from China. Many of the companies here, like Apple, have all their manufacturing in China, and there's heavy contact. So the 430,000 people who came to the U.S. from China since the coronavirus was first detected, probably a fairly large fraction of those 430,000 came directly here to Santa Clara County. We're by far the part of the U.S. with the most contact with China. Now, for sure, some of those people went to New York City for the financial industry, some business activities there, but Santa Clara County and its high-tech companies have far closer contact with China. Nonetheless, we have remarkably few cases and almost no deaths due to the disease. Now, people are frequently attributing that to the social distancing, although that wasn't in force until March 16th. So most of those 430,000 people came back to this area before President Trump's order banning travel from China. So there are 40,000 U.S. citizens who repatriated to the U.S. since, I guess, about February 1st or January 31st. So one would expect a lot of people to have come here with the virus from Wuhan and that area before the travel ban. And in fact, it is now supposed that there were several deaths due to COVID in February in Santa Clara County. We have the earliest known deaths now. Nonetheless, we have remarkably few cases and remarkably few deaths. Now, if aerosol transmission is a substantial mode of transmission of the coronavirus, confining large numbers of people to apartment complexes and buildings is likely to spread the disease efficiently through hallways, lobbies, laundry rooms, other shared spaces, and the ventilation system of the building. Similarly, shopping at a few giant stores like Walmart and Safeway, left open as a quote essential unquote, is likely to spread the disease efficiently. And indeed, more extensive testing appears to be showing the disease is much wider spread than originally thought or expected, which also, this is mostly a good thing, means it's much less deadly than original reports and claims. The seeming dramatic spread in New York City area, where about 1 in 5 people may have been exposed in a very short period of time, is easy to understand with substantial aerosol transmission. Also, there are now reports that about 66% of the deaths, or cases anyway, that have been picked up in New York City are people who are in fact, staying at home and supposedly sheltering in place and all that kind of thing. Uh, if there's significant aerosol transmission, that's not surprising. And in fact, if you're staying in a apartment building or something like that, at least it's very possible the organism will happily spread through the halls, through lobbies, through shared spaces, and through the ventilation system. So none of this is very surprising if there's substantial aerosol transmission. Well, what do we know about aerosol transmission? My thought process is generally that we should look at things we have studied for a long time to get a point of reference, such as influenza, which has ostensibly been very heavily studied because it is blamed for the 1918 sort of Spanish or swine flu epidemic. It's also been the subject of 2 major scares, one in 1976 when I was a kid and one in 2009. Remarkably, it isn't very clear how much transmission of influenza is due to aerosol transmission. You would think this would have been very carefully measured and determined as part of preparing for an influenza pandemic, but apparently not. Now, there are a number of references that you can find on PubMed, and these are the things I list here. So this is a specific analysis where they find that aerosol transmission accounted for approximately half of all transmission events. These are in Hong Kong and Bangkok and so on. There's a couple of reviews that I found. Aerosol transmission of influenza A virus, a review of new studies from 2009, and an earlier review by the same author in 2006. And these have tons of references. So if you're really interested in this, you can go read these reviews and then look at the references, which contain all kinds of studies and evidence that aerosol transmission is a big part of an influenza virus spreading. What about COVID-19? I think a big concern with recent papers is they're being produced in a general panic. People are under a lot of stress. People are in the grip of sort of the fight or flight response. So I think a special caution has to be made towards things that are coming out in the next couple of months. Some of them are almost certainly wrong. Maybe a lot of them are wrong. But nonetheless, I found some articles about airborne transmission of SARS-CoV-2. And one of the things, let's see, which one of these? So these talk about ventilation systems, and actually they, in fact, refer to studies that were done of the SARS outbreak in 2003, many of which show that it was transmitted by aerosol transmission. It was a major part of it. So the current SARS-CoV-2 is supposed to be similar to the virus in 2003. So you can look through these different references and the articles that they themselves refer to see that there's a pretty good chance that there's significant aerosol transmission. Now, I don't know this, and that brings me to my repeating conclusion, which again, there's remarkable lack of key measurements in the current coronavirus COVID-19 pandemic. These include things like the actual mortality rate. They also include the modes and rates of transmission, especially things like aerosol transmission, airborne transmission. Most of the papers that I found on PubMed dealing with aerosol transmission were specifically about medical procedures. And this has been one of the justifications for the aggressive use of intubation, is that if you just did the normal treatment for respiratory illnesses, which doesn't involve intubation, you'd get aerosol particles. If you gave people oxygen masks, they would get the aerosol particles, which might contaminate the doctors. And it was believed initially to be very, very deadly. So they were intubating people, at least there are reports to this effect, largely to protect the doctors and medical professionals. Now, there's a lot of moving goalposts and moving claims about intubation. It's generally considered, at least what I've understood from doctors I've talked to in the past, to be very dangerous and to be avoided. So there's likely to be a lot of backpedaling and stuff about the intubation. Now, the point is, all of this has basically not been measured. And people like the Centers for Disease Control and the National Security Bioweapons Defense Programs, which are presumably integrated with the CDC, should have been set up to quickly and efficiently collect all of these kind of things, including especially how a new disease is transmitted and how rapidly. But they seem to have been caught remarkably flat-footed despite billions of dollars that's been invested, specifically, for example, in preparing for an influenza pandemic. So why don't we have really solid information on how influenza is transmitted and whether aerosol transmission is a major factor? And this, of course, relates to the wisdom of the lockdown. The lockdown may make sense if you have contact transmission, but you don't have aerosol transmission. But if it's mostly transmitted by aerosol, for example, these methods are not going to be effective. And in fact, having everybody get inside an apartment building or complex may actually spread the disease, depending on the ventilation system in the hallways and other matters. And similarly, if everybody goes and shops at Safeway, they're going to breathe the aerosol particles into the Safeway or Walmart or whatever, and you basically have a single point where everyone will get exposed to the disease organism. It sounds a lot like something like that happened, maybe with the subway system in the New York City area. Why it hasn't happened in Santa Clara County is maybe puzzling. It suggests, as does the wide variations in the different numbers coming back from different areas, that there are various other factors, temperature, sunlight, various factors that we don't understand that affect the mortality, transmission of the disease, and other factors. And essentially all the focus is on the virus, not on environmental factors, not on other factors that may actually have more to do with what's happening and how to control it, how to contain it, how to cure it or treat it effectively. So that concludes this video, which was done on Sunday, May 10th, 2020. You can and should probably just read the article. I'll include the URL link to it in the show notes. I will also briefly include my professional disclaimer. I'm not a medical doctor or anything like that. If you need medical advice, diagnoses, treatment, all that sort of stuff, you should see a properly qualified medical doctor or other professional, depending on what your concerns are. And this is a rapidly changing situation where what we know is changing hourly, I guess. So that concludes this video. This concludes this video presentation. If you like this video, please click like. Please click subscribe and the notification bell if you would like to receive more content from us. You can avoid internet censorship by subscribing directly to our RSS news feed. Please consider sharing the link by email or on your website or blog, in addition to liking, upvoting, or sharing on increasingly censored, advertising beholden, and big company social media. We have encountered such censorship. Mathematical Software is developing software to automate data analysis, reducing the risks of costly errors and improving results. You can support our work financially by subscribing on our Patreon page. Scan the QR code in the lower right corner to get the Patreon link. Our Patreon link is also in the show notes below.